Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Coadministered Cagrilintide and Semaglutide in adults with overweight or obesity. Background: Semaglutide at a dose of 2.4 mg has established weight loss and cardiovascular benefits, and Cagrilintide at a dose of 2.4 mg has shown promising results in early phase trials. The efficacy of the combination, known as Cagri-Sema, on weight loss in persons with either overweight and coexisting conditions or obesity is unknown. Conclusions: Cagrilintide semaglutide provided significant and clinically relevant body weight reductions in adults with overweight or obesity, as compared with placebo. Next article: Cagrilintide semaglutide in adults with overweight or obesity and type 2 diabetes. Background: Cagrilintide and semaglutide have each been shown to induce weight loss as monotherapies. Data are needed on the co-administration of Cagrilintide and semaglutide, called Cagri-Sema, for weight management in adults with type 2 diabetes, including those in a subgroup who are undergoing continuous glucose monitoring. Conclusions: once-weekly Cagrilintide semaglutide, at a dose of 2.4 mg each, resulted in a significantly lower body weight than placebo in adults with obesity and type 2 diabetes. Next article: a crossover trial of hospital-wide lactated ringer solution versus normal saline. Background: whether lactated ringer solution is clinically superior to normal saline for routine intravenous administration of fluids is uncertain. Conclusions: a hospital-wide policy to administer lactated ringer solution rather than normal saline did not result in a significantly lower incidence of death or readmission to the hospital within 90 days after the index admission. Next, we will be discussing articles from Journal of American Medical Association. Dalbavancin for treatment of Staphylococcus aureus bacteremia. Question: is Dalbavancin a superior treatment option for complicated Staphylococcus aureus bacteremia compared with standard care? Findings: in this randomized clinical trial that included 200 adults completing therapy for complicated S. aureus bacteremia, the probability of a more desirable outcome at day 70 with Dalbavancin versus standard therapy was 47.7%, which did not achieve the pre-specified criterion for superiority, meaning among participants with complicated S. aureus bacteremia who achieved blood culture clearance, Dalbavancin was not superior to standard therapy for achieving a more desirable outcome at day 70. Next, we will be discussing articles from Annals of Internal Medicine. Geographic variation in receipt of care by specialized oncologists. Background: the growing complexity of cancer care may be driving an increase in subspecialized medical oncologists who focus on treating specific cancer types. However, little is known about trends in subspecialization among oncologists and differences in utilization of subspecialists. Conclusion: subspecialization in oncology is increasing, but is unevenly distributed, with growing differences in utilization across income groups and regions. Next, we will be discussing articles from British Medical Journal. Global, regional, and national characteristics of the main causes of increased disease burden due to the COVID-19 pandemic. Objective: to quantify and identify the main causes of increased disease burden due to coronavirus disease 2019, COVID-19, pandemic. Conclusion: the COVID-19 pandemic significantly increased the burden of several non-COVID conditions, particularly mental health disorders, malaria in young children in the African region, and stroke and ischemic heart disease in older adults, with notable disparities across age and sex. These findings underscore the urgent need to strengthen health system resilience, enhance integrated surveillance, and adopt syndemic-informed strategies to support equitable preparedness for future public health emergencies. Next, we will be discussing articles from Lancet. Extending the duration of endocrine treatment for early breast cancer, patient-level meta-analysis of 12 randomized trials of aromatase inhibitors in 22031 postmenopausal women, already treated with at least 5 years of endocrine therapy. Background. In postmenopausal women with estrogen receptor-positive early breast cancer, 5 years of adjuvant tamoxifen substantially reduces 15-year recurrence and mortality. Aromatase inhibitor treatment, AIT, is even more effective. We assess the effects of further 8 among women recurrence-free after at least 5 years of endocrine therapy TI interpretation. Allocation to 5 further years of 8 reduced subsequent distant recurrence rates by about a quarter, despite substantial non-adherence. Longer follow-up would have been needed to help assess directly any effects on mortality. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Integrating Quality of Life and Survival in Systemic Therapy for Advanced Hepatocellular Carcinoma Network Meta-Analysis. Question: among available first-line systemic therapy options for unresectable or advanced hepatocellular carcinoma, which treatment provides the optimal balance between overall survival benefit and preservation of health-related quality of life? Findings. In this network meta-analysis of 9 phase 3 randomized clinical trials including 6,425 patients, atezolizumab plus bevacizumab showed the highest probability of reducing deterioration in most quality-of-life domains: global health status 85%, abdominal swelling 95%, abdominal swelling 95%, jaundice 89%, pain 86%, whereas tislelizumab ranked highest for physical functioning, 96%, and fatigue. When integrating quality of life with overall survival, atezolizumab plus bevacizumab significantly outperformed all other treatments across all assessed domains, meaning these findings indicate that atezolizumab plus bevacizumab provides the optimal balance between survival benefit and preservation of quality of life, compared to other first-line systemic therapy options in unresectable or advanced hepatocellular carcinoma, offering a more patient-centered approach for treatment selection. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Clinical Gastroenterology. Non-invasive disease assessment in eosinophilic esophagitis, with fractionated exhaled nitric oxide, blood, and fecal biomarkers. Background. Eosinophilic esophagitis (O) is a chronic inflammatory condition of the esophagus triggered by food and aeroallergens. There is a need for non-invasive biomarkers that reliably detect O in patients with cardinal symptoms and predict treatment response to reduce endoscopic evaluations to occlusions. Assessment of FeNO may have diagnostic value in differentiating patients with active O from non-O patients, but is not a suitable marker for monitoring disease activity. Serum EDN, ECP, TARC, and AEC levels are emerging as potential candidates for monitoring disease activity in O. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Safety of triple-dose rifampin in tuberculosis treatment, a systematic review and meta-analysis. Background. Recent studies suggest that triple-dose rifampin, TDR, greater than or equal to 30 mg/kg/d, may be unsafe. We updated a systematic review to investigate the safety and efficacy of TDR conclusions. Regimens that used TDR were associated with an increase in SOVs, raising concerns regarding safety of TDR regimens. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Validation of the ANC-associated vasculitis patient-reported outcomes questionnaire in a Latin American vasculitis cohort. Background/objectives. The aim of this work is to validate the ANC-associated vasculitis patient-reported outcome (AVPRO) questionnaire in a Latin American, Peru, A.I.O cohort. Conclusions. The Spanish version of the A.I.O questionnaire correlated with the SF36 in A.I.O patients from a Peruvian cohort. These findings may support the use of this instrument in other Latin American populations. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Association of smoking cannabis with cardiovascular events among veterans with coronary artery disease. Background. Whether cannabis is a risk factor for cardiovascular events is unknown. We examined the association between smoking cannabis and cardiovascular events in a cohort of older veterans, 66 to 68 years of age, with coronary artery disease. In this cohort of older veterans with coronary artery disease, self-reported cannabis use was not independently associated with increased cardiovascular events over a mean of 3.3 years of follow-up. Here are the articles from Journals of the American College of Cardiology. Recurrent Events Analysis of Master DAPT. Total ischemic and bleeding events after abbreviated versus prolonged DAPT in HBR patients. Background. The effect of dual antiplatelet therapy, DAPT, duration on total events in patients at high bleeding risk, HBR, after percutaneous coronary intervention, PCI, is unclear. A 1-month DAPT duration was associated with similar total NACEs and masses and reduced total bleeding risk compared with prolonged DAPT. Providing a more comprehensive assessment of the total clinical burden, these findings support the use of an abbreviated duration of DAPT after PCI in HBR patients. From JAMA Cardiology. Early Childhood Food Insecurity and Cardiovascular Health in Young Adulthood. Question: is food insecurity in early childhood associated with worse cardiovascular health in young adulthood? Findings. In this cohort study of 1,071 children followed up to young adulthood, food insecurity in early childhood was associated with worse cardiovascular health among young adults, associated primarily with a higher body mass index. Supplemental Nutrition Assistance Program participation was associated with mitigation of the association of childhood food insecurity with cardiovascular health in young adulthood, meaning this study suggests that early childhood food insecurity, especially among children who did not participate in the Supplemental Nutrition Assistance Program, may be associated with worse cardiovascular health in young adulthood. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Trends in Osteoporosis Drug Therapy Receipt Among Commercial and Medicare Advantage Enrollees in the United States, 2011 to 2022. Context. A national assessment of osteoporosis drug therapy, ODT, use can inform the extent of underdiagnosis and undertreatment of osteoporosis objective. The aim was to describe trends in ODT use by age, sex, fragility fracture, and documented osteoporosis. Conclusion. ODT use for patients with documented osteoporosis has increased but remains low. Low rates of ODT use for patients with fragility fractures in the absence of documented osteoporosis suggests that underdiagnosis of osteoporosis contributes to underuse of ODTs. Here are the articles from Diabetes Care. Lack of validity of the glucose management indicator in type 1 diabetes and pregnancy. Objective. The glucose management indicator, GMI, is widely used as a replacement for HbA1c, but information in pregnancy is very limited. We assessed the accuracy of GMI and associations with pregnancy outcomes in type 1 diabetes. See inclusions. GMI is not an accurate replacement for HbA1c in pregnancy and women with type 1 diabetes. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Real-world evidence of brexpiprazole use and 6-month mortality, hospitalization, and emergency department visits among persons with dementia. Background and objectives. Alzheimer's disease and other dementias are accompanied by depression and agitation and other behavioral and neuropsychiatric symptoms. In 2023, brexpiprazole became the first antipsychotic approved by the U.S. Food and Drug Administration to treat agitation in persons with Alzheimer's disease, but, like all atypical antipsychotics, it includes a black box warning of an increased risk of mortality among persons with dementia. This study provides real-world evidence of mortality in a heterogeneous sample of brexpiprazole users to understand effects in the population. Discussion. Brexpiprazole use is not associated with differential mortality risk compared with aripiprazole use among PLWD. Brexpiprazole offers a treatment option which is important given the heterogeneity of effects of antipsychotics on persons. A two-stage least squares method is used to eliminate bias on estimates because of observed and unobserved differences between the two groups, but the small sample size is a limitation. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Continuous glucose monitoring for hyperglycemia in critically ill patients. A randomized controlled trial. Background. Continuous glucose monitors, CGMs, could potentially improve management of hyperglycemia compared with standard point-of-care glucose monitoring for critically ill patients. However, there is limited evidence to support routine use of CGMs in the ICU. Research question. In critically ill patients with hyperglycemia, do CGMs improve time within target glucose range compared with standard of care? Interpretation. The results of this study do not support CGMs as a superior method for routine glucose monitoring in the ICU compared with standard of care. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Endotypes of Pseudomonas aeruginosa infection in bronchiectasis are associated with inhaled antibiotic response. Results from two randomized, double-blind, placebo-controlled Phase 3 trials, ORBIT-3 and ORBIT-4 rationale, replicate Phase 3 trials of inhaled antibiotics in patients with bronchiectasis, have produced inconsistent results. Objectives. This study investigated if different microbial and inflammatory endotypes are linked to antibiotic response in patients with chronic Pseudomonas aeruginosa infection. Conclusions. Patients with chronic P. aeruginosa have heterogeneous microbiota and inflammatory profiles, influencing antibiotic treatment responses in bronchiectasis. Future trials could be improved by patient stratification, including accounting for geographical differences and biomarkers to represent microbiota differences. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Core Outcome Measure for Life Participation in Patients with CKD, Standardized Outcomes in Nephrology Workshops Report. Patients, caregivers, and health professionals support the use of standardized outcomes in nephrology, life participation as the core outcome measure for life participation in patients with CKD. Further work is needed to pilot and validate the standardized outcomes in nephrology, life participation measure in patients with CKD before the need for KRT. A core outcome measure will support consistent reporting of life participation in trials in patients with CKD. Next article. Frailty in adults with CKD and validation of the kidney failure risk equation in frailty subgroups. The four-variable kidney failure risk equation, KFRE, does not accurately estimate kidney failure risk in frail individuals. Prognostication of kidney failure is improved in frail individuals with CKD by replacing EGFR creatinine with cystatin C-based EGFRE in the KFRE model. Consideration of competing mortality risk is particularly important in those with frailty and higher KFRE risk predictions. Here are the articles from Kidney International Reports. A systematic review of treatment for acute interstitial nephritis. Introduction. Acute interstitial nephritis, AIN, is a common cause of acute kidney injury. It is characterized by tubular inflammation with eosinophils histologically. The mainstay treatment for AIN includes early diagnosis, underlying infection or systemic disease treatment, cessation of the offending agent, and corticosteroid therapy when indicated. This systematic review aims to evaluate the efficacy and safety of pharmacotherapy treatments for A.I.N. by assessing treatment outcomes and adverse effects. TONS conclusion. Consistent evidence supporting the use of corticosteroids for treating A.I.N. needs to be more comprehensive. There needs to be a clear consensus on the optimal treatment regimen. High-quality randomized controlled trials are required to help establish evidence-based guidelines for treating A.I.N. Next article. Double icodextrin dose randomized controlled trial of a double icodextrin dose for older patients on incremental continuous ambulatory peritoneal dialysis. Introduction. Icodextrin enhances ultrafiltration (UF) in patients on peritoneal dialysis (PD), but is restricted to 1 bag/d, according to regulatory authorities. The double icodextrin dose (DIDO) study is a prospective randomized trial investigating the superiority and safety of using 2 bags/d versus 1 bag/d of icodextrin to extend incremental 3 bags/d continuous ambulatory PD (CAPD) duration in older incident patients. Conclusion. In older patients on incremental CAPD, the double icodextrin dose did not reduce the primary outcome incidence compared with the single icodextrin dose. Significantly enhanced UF was observed in the double icodextrin dose group, and no safety issue was identified.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.